Webcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everyone. Today is Tuesday, May 19th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you and thank you for joining us. Today's presentation is the DDA Self-Directed Service Delivery Model Expectations Appendix K Guidance. We have several DDA panelists today. First, we have Patricia Sastoki, Director of Programs. We also have Rhonda Workman, Director of Federal Programs. We have Mary Jane Asazuwa, IT Functional Analyst Supervisor. We have Ron Peel, Budget Director. Casey Brown, Federal Billing Administrator. Dr. Yamanja Smalls, Director of Coordination of Community Services. Natoya Mitchell, Director of Self-Directed Services. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is one option to listen to the webinar, and that's by computer. There is a handout for this webinar, and you will be able to find it in the handout section. They also can be emailed if you don't get it. We're recording the webinar, and it will be posted on the DDA website. Questions can be typed in the webinar panel, the question box, or the chat box. And so now I'd like to introduce Patricia Sastoki. Good afternoon.
Good afternoon, Donna. Thank you so much for that wonderful greetings, and thank you all for joining us today in our self-directive delivery model Expectations-Appendix K. This is our second webinar that we're doing in reference to this, and this is more specific to really be able to drill down and engage more with you all about what it is that we're doing with Appendix K with people in self-directed services. So thank you for joining us today. The DDA operations and programs have created today's presentation to provide additional guidance for people in self-direction, coordinators of community services, the physical management services, family members. And so we hope that today's webcast will give people really a good understanding of how to operationalize and implement Appendix K. We will be breaking each section down to provide you with an opportunity to ask us questions, to be able to give the answers, and then be able to move forward. It is a lengthy presentation, but we think it is really critical and important to go over each section just based on some of the questions and the emails that you've submitted to the DDA. The goal is that today's discussion will be able to give you a really good insight of what you need to do. So the way we outline today is that we're going to give you a summary of what's in the Appendix K under the Memo 11 that you all received and we have in our website. We're also going to break it down and say, so what does this mean to you as a participant if you're self-directing your services? And what does this mean to a CCS, and what do they need to do to support a person in self-direction? And what does it mean to a physical management service agency who's supporting a person, and what do they need to do? So that's what the goal of today's session is going to be, and it's going to be framed that way, and then we'll show a couple of slides, and then we'll open it up to questions. I'm going to ask you to please ask your questions specific to the topic that we're talking about. Your questions are very important to us, and we want to be able to provide the answer, but I need you to stick to the topic that we're discussing in the screen and you can see, and then we'll go through that. Okay, so I'm now going to turn it over to Rhonda Workman.
Great, thank you, and good afternoon, everybody. Today we are going to talk about a variety of self-directed service delivery model provisions and flexibility that we received from CMS with our Appendix K. It provides the option for people to use their existing budget to move funds to meet their immediate needs, to exercise some exemptions related to staffing, to meet their immediate needs, and to also seek some additional supports from the DDA. So to support the immediate needs, we have made these temporary modifications, and with these modifications, there's additional information and support that's available to you. So we do have a vast amount of information on the DDA website, and we will be posting today an update to our frequently asked questions that'll include several questions related to self-direction and staffing flexibilities. In addition, your coordinator of community services and your fiscal management service provider and the DDA regional office is available to support you. So some of the provisions we're going to talk about today, we have been sharing in previous webinars, but it includes accessing services without pre-authorization, services being provided in alternative sites, some information about budget modification abilities and provisions. We're going to talk a little bit about an increase of budgets.
Rhonda, we're losing you.
Support services. I'm sorry. Can you hear me now better, Patricia?
Yes.
Okay. So as noted on the screen, we're going to talk about a variety of provisions in terms of accessing things without pre-authorization and then what next steps need to happen, services in other sites, the ability to make budget modifications on your own, and then also to utilize some new funding up to $2,000, and also the ability to request additional personal support services. Next slide, please. Some additional provisions include the ability to indicate or pay a higher rate for your staff when you may have a positive COVID-19 determination, the ability to services COVID-19 needs, the ability to use your pay in the form of like a retainer payment, some exceptions to our services related to number of hours per day, and also a variety of flexibilities in terms of making exceptions to maybe some of your staff training and onboarding opportunities, and also the ability to use telephonic remote services. So in terms of accessing behavioral support, nursing services, and respite without pre-authorization, there is a process and form that we have outlined related to do that. So for nursing services and BSS services, participants will request these changes using the revised cost detail sheet. And in terms of the additional 360 respite care service hours, we are going to be sending a global authorization to the fiscal management service providers to automatically authorize 360 hours for all participants in their budget, and therefore no additional action is required by you. Next slide, please. Natoya?
Rhonda, can you hear us?
I cannot hear anybody.
Natoya?
To support the immediate need for new COVID-19 related services and supports for participants who have chosen to self-direct their services, the DDA's approval under the Appendix K for modification to requirements, processes, and funding under the self-directed services delivery model, including access to behavior supports, nursing services, and respite. Completion and submission of the modified service funding plans, revised person-centered plans, and budget modifications are not required to access these services. If you are a self-directing participant and are not currently receiving behavior support services or nursing services, you can start by requesting authorization from the DDA to address your immediate needs. Participants must work with their CCS so that the CCS can submit the revised cost detail sheet within 5 business days of the identified assessed need or accessing these services in order to receive authorization and funding. The DDA will acknowledge receipt of email from the CCS, review the request, seek additional information as needed, and authorize, if appropriate, the service on the revised cost detail sheet. Additionally, the DDA will send an email to the participant's FMS provider with a copy to the CCS with determination. If you are unsure as to which behavior support service or nursing service is needed, please contact your CCS or DDA regional office for assistance. Next slide, please.
What does this mean for CCSs and what do they need to do? First, the CCS needs to discuss needs, services, and the budget during the wellness checks and their monitoring and follow-up activities with the participant. And they need to document in the activity and progress notes in LTSS. Please reach out to the regional office nurse and the DSS lead staff if assistance in identifying appropriate services and supports to meet those immediate needs are required. And the CCS will be submitting the revised cost detail sheet within 5 days of identified need being assessed. Next slide, please.
In order to access behavior supports, nursing services, and respite without pre-authorization, what does this mean to the FMS and what do they need to do? First, they need to acknowledge receipt of the revised cost detail sheet from the DDA and copy the participant and CCS. Secondly, they need to facilitate new employee or vendor-related processes and paperwork. And thirdly, process participant authorized timesheets or invoices based upon the DDA authorization. Fourthly, to track, report, and process claims. And lastly, to follow up with the DDA on process or person-specific questions. Next slide, please.
Another provision within Appendix K is the ability to provide or receive services in alternative service sites. So services may be needed to be provided in different sites because you may need to relocate based on maybe family members or others that have positive COVID-19 determination, or maybe just because it better meets your needs. And so people are able to choose those options and separate based on that and other exposures. Next slide, please. Participants such as acute care hospitals or receiving a short-term institutional stay. Alternate site options, such as maybe another family member's home or a friend's home, an alternative facility-based setting, even your staff or direct care worker homes, hotels, schools, churches, and other community established sites. In addition, services can be provided out of the state of Maryland, in neighboring states, and the District of Columbia. Next slide, please.
As a reminder, the DDA has approval under Appendix K for modifications to requirements, processes, and funding under the self-directed services delivery model. This includes services being rendered at alternate service sites. So what does this mean to participants and what do they need to do? As a self-directing participant, you can receive some services in new places, including the hospital. You need to inform your CCS when this happens so the CCS can inform the DDA. Next slide, please.
So what does this mean for the CCS? During wellness checks and their monitoring activities, the CCS needs to discuss where the services are being provided or the potential need to relocate, and they should be documenting this discussion in their activity note in LTSS. The CCS is responsible for submitting the DDA COVID-19 site notification when services are being provided in the hospital setting. Call the participant on a monthly basis at minimum for out-of-state services. The CCS should also document this contact within LTSS Maryland monitoring and follow-up section of the system. And during their wellness checks, they should be documenting the same in their activity and progress notes. The CCS should be notifying DDA regional office of any issues or discrepancies noted and file incident reports as applicable. Next slide, please.
In terms of alternative sites, what does this mean for FMS and what do they need to do? Essentially, the FMS just needs to process timesheets and invoices as usual. Next slide, please.
So now we're getting to the section with the first questions that we're going to read out, and then we're going to provide the answers to. So will persons be copying all of the correspondence between CCS, DDA, and FMS?
So this is Rhonda. That's a great question. And currently the DDA does not have in our data system the email addresses where, as we've noted in our slides, for the FMS to acknowledge the that we've been sending copy the participant.
So Rhonda, we're having a very difficult time hearing you and understanding you. You're going in and out, and that's what we're being told on the screen here. Some folks have asked, could you provide a copy of the PowerPoint presentation? And Donna is uploading it to the chat box. So you'll be able to see it in your right-hand corner of your screen in a few minutes. You should be able to pull that up. So on slide 9, what are BSS lead staff? Thank you.
So that's a great question. Each regional office has a behavior support service staff that's designated as the subject matter expert and is available to assist.
Okay, I'm just sticking to the questions specific to the topic that we just talked. So there's a lot of questions that's getting ahead, so I'm not reading those out loud so we can move through the presentation. So BSS, nursing services, and respite has been all grouped together, but I want to confirm respite, no action is needed, but BSS and nursing require forms. Is this correct?
Yes, that is correct.
Okay. I'm just reading the ones related to the topic. Are you saying if a person has behavior supports in their budget, we can access those funds and use for personal supports?
If you have behavior support services in your receive those services now. The provision that we established was for people who do not have behavior support services or nursing services in their current authorized budget, so that they could access those immediately to meet their immediate COVID-19 related health and safety needs, and then to follow up with a revised cost detail sheet so that we can authorize the funding for that.
So if this can be authorized without pre-authorization, then what is DDA's authorization form?
So the ability to access those services, to start those services without first coming to us to ask for permission, is what we're talking about in terms of accessing without pre-authorization. But we still need to authorize the service and authorize the funding. And so knowing that some people need immediate services for health and safety, we wanted to be able to provide provision for people to access that, but then you need to follow up with the formal request so that we can authorize the funding.
What constitutes a neighboring state? It's my last one, and then I'm going to go back to the presentation.
So a neighboring state is a state that borders Maryland. So we're talking about Pennsylvania, Virginia, West Virginia, and the District of Columbia.
Okay, so let's go to the next topic.
Let's discuss budget modifications within approved budgets. To ensure the health, safety, and address immediate direct staff supports or services needed during the COVID-19 crisis, without DDA's prior authorization, participants may move funding across approved budget service lines to move funds from a current authorized service to another authorized service, and move funds from a current authorized service to a new service covered by the waiver program in which the participant is enrolled. Therefore, participants are able to move funds from services that they may not be accessing or receiving due to the pandemic to other service items to meet their immediate health and safety needs. Completion and submission of the modified service funding plans, revised person-centered plans, and budget modifications are not required to access these services. I will show you this when we get to the form section. Next slide, please. The DDA has created the DDA COVID Form number 5, which was developed to request to move funds across existing budget service lines or add new service lines. Secondly, you can request to increase budget up to $2,000, request to increase budget above the $2,000, and request for retainer payments. With this form, you can move funds from services you may not need or use at this time to another or new service that you need to help with your immediate needs during the COVID-19 crisis. You will use a new form, the DDA COVID-19 self-direction, again, which is called the DDA COVID Form number 5, to make changes. Your CCS can help you with completing the form and submitting to the FMS. Your FMS will review and process. Next slide, please.
The CCS has key responsibilities in supporting the person in making budget modifications. Discussing the immediate needs, service, and current budget during their wellness checks and monitoring and follow-up activities is really crucial. The person self-directing their service would need to discuss some of their concerns, and the CCS would document this in their activity and progress notes in LTSS. The CCS is responsible for supporting the participant in the submission of the DDA COVID-19 self-direction form to make budget changes and to document this contact in LTSS monitoring and follow-up forms, and as mentioned prior, the activity and progress notes. The CCS should inform the DDA regional office of any significant health and safety concerns. Next slide, please.
In order to facilitate the budget modifications within approved budgets, there's certain key things that this means in terms of FMS. The FMS is to acknowledge receipt of the request. The FMS is to also review and process as per criteria for approving or denying requests outlined in the Appendix K, number 11, self-direction service delivery model exception. And the FMS is to send the form with its determination to the participant, the CCS, and the DDA. Note, if the FMS provided determination is to deny the request, the DDA will review that determination. If DDA determines that the denial was proper, DDA will issue notice of its decision, its legal and factual basis, and applicable appeal rights as required by Section 10-207 of the State Government Article of Maryland Annotated Code. Next slide, please.
An additional $2,000 already been added to the self-directed budget for participants enrolled in the service delivery model. This amount is to address the immediate need so that participants may use the funds for additional direct support services, such as personal supports, community development services, increase support broker hours up to 20 hours per month, staff recruitment, of which is limited to an additional $500, and purchase personal protective equipment or supplies, such as gloves, masks, gowns, face shields, and cleaning supplies. As a note, to comply with federal requirements and prevent duplication of funding, all participants who are self-directing their services will be able to access the additional Appendix K budgetary increases as long as their self-directed budget is current and submitted to the FMS. Participants with outstanding budgets should contact their DDA regional office self-direction liaison for immediate assistance to resolve outstanding items. To date, there are about 30 participants whose budgets need to be finalized. Next slide, please. The additional $2,000 increase for the use toward additional direct support services and support broker hours is for direct services and cannot be used for paid time off. The DDA will consider requests for these services or items that exceed the $2,000 increase. Requests for budget modifications for other services or items not listed in Appendix K shall be submitted per the standard typical modified service funding plan requests and budget modifications processes. Next slide, please. If you do not have available funds for these services or items, you can submit a request on how you would use these new funds. You will use a new form, and that form is the DDA COVID-19 self-direction, which is also called the DDA COVID form number 5. Your CCS can help you with completing the form and submitting to the FMS for costs up to $2,000 or to DDA for costs above $2,000. Your FMS will review and process.
The CCS is responsible for discussing the immediate needs, services, and current budget during their wellness checks and monitoring activities and document such in the activity notes. The CCS is responsible for participating in the completion and submission of the DDA COVID-19 self-direction form as needed and document that contact in their monitoring and follow-up forms and activity notes. They should inform the DDA regional office of any significant health or safety concerns and ask any additional questions if they need to in relevance to the additional $2,000. Next slide, please.
What does it mean for the FMS when there's an authorization request to increase budget by $2,000? The FMS is to acknowledge receipt of request, to review and process as per criteria for approving or denying requests outlined in the DDA Appendix K, number 11, Self-Directed Service Delivery Model exception. And the FMS is to send the form with its determination to the participant, the CCS, and the DDA. Note, if the FMS provider's determination is to deny the request, the DDA will review the determination. If DDA determines that the denial was proper, DDA will issue notice of its decision, its legal and factual basis, and applicable appeal rights as required by Section 10207 of the State Government Article of Maryland Annotated Code. Next slide, please.
The DDA added $2,000 COVID-19 fund for the self-directed services using the existing community supports waiver and family supports waiver process in PCIS2. Next slide. The additional $2,000 increase for the use towards additional direct support service and support broker hours, the DDA invoice submission process remains unchanged. Next slide, please.
Mary Jane. I think we're going to open up for questions for this particular presentation. Let's see, we ended at 2:20 with the questions. And let's see if there's any questions specific to this topic. I'm a provider for a client. How do I know whom my client FMS is? You can contact your regional office and then we'd be happy to let you know who that FMS is if you give us the name of the person and we can look it up. 2,000 is automatically added to everyone's budget, or is it only done so when the form is submitted to the FMS? So Mary Jane just, so Mary Jane just showed on the slide previously that it was already added automatically to the person's budget, correct, Ron?
Yes.
Okay. Can you repeat who is to be contacted if your budget is still not approved? Email the CCS, says it under review. Budget was turned and on February. So I think what Natalia has said, to please contact your regional office or contact your CCS agency. Okay, I'm going to move over to the next slides.
Great. So this provision is about for participants whose meaningful day services were closed due to the pandemic. Additional personal support service hours may be needed for some people. As noted in our guidance, participants who prior to the state of emergency were receiving meaningful day services that were currently receiving 28 hours or more can be authorized additional hours during the week to support their needs. Next slide, please. Participant self-directing services and meaningful day services currently vary weekly. As we looked at the data, we see that people are using it at different frequencies. Therefore, the DDA will consider requests for increases to personal support to meet a set. In addition, under the self-directed service delivery model, remember that participants have flexibility to move funds to different services to meet immediate needs, including moving funds from meaningful day services or other services that cannot be used or accessed at this time to increase personal support. In addition, you can access that additional $1,000 that we've increased to your budget to also access personal support. Next slide, please.
For personal supports increase addressing an immediate need, a participant can make budget modifications, request to use the additional $2,000, and/or request to increase service authorization from the DDA. If you are unsure as to whether your current budget or additional $2,000 will meet your needs, please contact your CCS, DDA, or the regional office for assistance. If new service authorization is needed, your CCS can submit the revised cost detail sheet to the regional office. Next slide, please.
In a discussion with the person during their wellness checks, monitoring, and follow-up, the CCS should help the participant determine their personal support needs and document this discussion in their activity and progress notes in LTSS. They should reach out to the regional office for additional assistance as needed and submit the revised cost detail sheet to the DDA if this is a new service request. Next slide, please.
When a participant is requesting to access a personal supports increase, what this means for the FMS, and what does the FMS need to do? Several things. Acknowledge receipt of the revised cost detail sheet from the DDA and copy the participant and the CCS. The FMS is to facilitate employee or vendor-related processing and paperwork. The FMS is to process participant-authorized timesheets and invoices based on the DDA authorization, and the FMS is to track, report, and process claims. And lastly, the FMS will follow up with the DDA on process or person-specific questions. Next slide, please.
Okay, so we're going to open it up and see what we have in the question box for this section. So how quickly will the regional office respond to questions? So the DDA is responding to questions in multiple ways. We are doing when you submit questions to the DDA toolkit email, we try to do those every other Friday. If you submit specific questions to the regional director, we expect them to respond to you within 24 hours. The next one is, does attending public school count as a meaningful day service?
a great question, and attending public school is not considered a meaningful day service. Our meaningful day services include our supported employment, our community development services, and rehabilitation services.
What are the effective dates of Appendix K?
Appendix K became effective March 13, 2020, and will be effective until March 12, 2021, unless otherwise authorized.
So there's one question here. So COVID-19 Form 5 response time is within 24 hours then. So please remember that in the PowerPoint presentation, it says you submit your Form 5 to your FMS. They have the authority to approve and deny. Anything above 2,000, it goes to the DDA regional office. I'm now going to continue on with our presentation.
Great. So another opportunity under Appendix K relates to the ability to pay an increased rate. So participants self-directing services can authorize a higher pay rate for personal support, nurse consultation, and nurse case management and delegated services for their staff for directly supporting them that when they have a positive COVID-19 determination. For eligible participants that have that positive COVID-19 determination, the increase rate can be requested beginning the date of that determination and can be paid up to 21 consecutive days. Next slide, please.
What does an increased rate mean to participant self-directing services, and what do they need to do? As a participant self-directing, you can offer a higher rate to your personal support and nursing staff to support you while you are isolated. You must sign timesheets and/or invoices indicating hours the services was eligible for the increased rate by noting IS on the day. Please submit the timesheets and/or invoices with supporting documentation of positive determination to your FMS. You must maintain documentation of the direct services provided for this increased rate and provide the documentation upon request. Next slide, please.
As with all of these provisions, the CCS should discuss needs, services, and the budget with the participant during their wellness checks and monitoring and follow-up activities. They should document these discussions in their activity and progress notes in LTSS. The CCS should offer increased wellness checks due to the positive COVID-19 determination, and they should be sensitive to the needs of the person when this request is made. They should provide assistance in exploring additional services or items needed, for example, personal protective equipment, personal supports and nursing, and alternative service sites for the actual delivery of those services. They should reach out to the regional office for assistance, and it's important that the CCS submit incident reports as needed. Next slide, please.
What does the increased rate for isolation of a participant during COVID-19 pandemic mean for the FMS? The FMS will process participant authorized timesheets and invoices with supporting positive determination at 150% of the established rate on March the 13th, 2020, up to 21 consecutive days. The FMS must also track, report, and process claims using the existing procedure codes for these services. FMS will follow up with the DDA on process or person-specific questions. And lastly, the FMS will note isolation days in the year-end reconciliation. Next slide, please.
Okay, this opens up for our questions under this section. And yes, we are getting questions. And I'm just reading just the ones that are specific to the topic that we're talking about, because there's a lot of questions that people are asking about different things, but I'm keeping it based on the topic. If the FMS requires to maintain the documentation stating the positive determination, Yes, they are required to determine because you need to know who's paying, who you get in the higher rate. Can we increase the rate of pay if a staff tests positive with COVID? We are thinking the other staff will want an increased work.
So under the provision for,
go ahead, Rhonda.
I was just gonna say that the provision for Appendix K, the increased rate is for can only be applied when the participant has a positive 19 determination.
Does the 150% pay rate come out of the participant's current authorization?
Yes,
Yes.
Okay, I'm going to read two more, then I'm going to continue with the presentation. How often should the participant be contacted once diagnosed with COVID-19 regarding wellness check, Dr. Smalls?
It's preferred that it's at least once weekly, but we want the CCS to be sensitive in their discussion with the participant and their authorized representative, legal guardians, to ensure that if they need more frequent checks or would prefer not being contacted as frequently, that they communicate that with their CCSs. The main point is that we want them to be supportive, and if there's any needs to discuss or changes in, if they have any changes in their status.
So what information is required to prove a positive diagnosis, Rhonda?
That's a great question. And so we have noted in our guidance and some of our previous presentations, it could be the results of a test. It could be a determination from a primary care physician. It could be a determination at a testing site that based on the information you provide, they have determined you to be positive. And so what you'll want to do is to either have a supporting documentation in terms of that actual test result, or be able to provide information such as the source of that determination, the date, and also the contact person associated with that.
Thank you. We're going to now move to the next section.
Great. So this section relates to new service requests. And so to support the immediate need for new COVID-19 related services and supports being met by that budget modification or accessing those additional $2,000, the DDA established a new temporary service authorization request process that is outlined in our Appendix K number 5 guidance. Requests for immediate COVID-19 health and safety related needs for new or additional services can be submitted by the participant. The revised detail sheet. Next slide, please. We are revising our guidance related to the email submission by the CCS to the DDA. We're going to replace the CCS name and have them insert the participant number. This email request with the revised cost detail sheet is sent via a secured email to the DDA dedicated. And again, the email subject line would read the participant's LTSS ID number and then COVID-19 service authorization request and date. Next slide, please. So some of the questions we've been receiving is, when would you use the revised cost detail sheet? Again, requests for immediate COVID-19 health and safety related needs for new additional services that are not being met by that budget modification, or utilizing that $2,000 increase, or requesting to go above that $2,000 increase, or even using and accessing those additional respite care service authorization. If you find you need additional services and supports, then you would use the revised cost detail sheet for items such as additional personal supports, maybe some additional CDS services if those are being provided, or support broker services, or support services such as our assistive technology, the behavior support services, and nursing. Next slide, please.
What does this new COVID-19 related service request mean to participants, and what do they need to do? As a self-directing participant, you can request the increased service authorization from the DDA to address your immediate needs without going through the modified service funding plan process. If you are unsure as to whether you need to submit a request, your CCS and support broker in the DDA regional office can assist. If new service authorization is needed, your CCS can submit the revised cost detail sheet to the DDA regional office.
As Natoya just mentioned, the CCS is the one responsible for submitting the revised cost detail sheet to the DDA for any new COVID-19 related services the person may be requesting. Next slide, please.
What does the request for new COVID-19 related service, new or additional service means in terms of the FMS, in terms of what the FMS needs to do? First, the FMS needs to acknowledge receipt of the revised cost detail sheet from the DDA and copy the participants in CCS and facilitate employee/vendor related processes and paperwork. Third, the FMS needs to process participant authorized timesheets and invoices based on the DDA authorization. Track, report, and process claims. And lastly, the FMS needs to follow up with the DDA on process or person-specific questions. Next slide, please.
Okay, I think we're going to go into our question section. And under this section, it says that what is the period of availability for the $2,000?
So that's a great question. For the $2,000, it would be available for the period of Appendix K, so that's March 13, 2020 through March 12, 2021.
And does it have to be COVID specific related, or could we just ask for anything that we want with that $2,000?
That's another great question. And as we noted in our slides, it's really for 4 specific areas. One would be direct support. So if you needed some additional personal support or support broker hours, you could use that. You could use it for staff recruitment strategies up to additional $500. And also you could use it to purchase personal protective equipment, those masks and gloves and cleaning supplies. Those are the only purposes that you could use that $2,000.
And Rhonda, where can I find that form, the LTSS DD Form 5?
That's a great question. On the DDA website, we have a designated page for Appendix K. And if you scroll near the bottom, all the forms are there to include the Appendix K DDA form number 5 that is used specifically for people self-directing services.
So just to clarify, the 360 respite hours can be funded above and beyond both the current budget and the 2000 funded increase?
Yes, that is true.
Okay, I'm going to continue with our presentation and we'll go back to questions.
Great. So this section, we're going to talk about retainer payments and paid time off. And as we've shared, we recognize during this COVID-19 pandemic, some participants may choose to stay home with their families and receive supports from them or other natural supports. Some may request altered or reduced service delivery because they don't want staff potentially coming into their home. And some may be supported in other systems such as hospitals and such. Under Appendix K, it provides the opportunity to make limited payments to waiver providers known as retainer payments while the participant is not being served due to the COVID-19 pandemic. Retainer payments are paid from existing service authorization Therefore, no new funding is allocated. Next slide, please. So participants, self-directing services, as the employer of record, as you know, determines schedules, pay rates, and benefits. Time off, so authorize timesheets and invoices based on their approved budget. So unlike the traditional service model for providers, participant self-directing services utilize paid time off just like a retainer payment that a provider under traditional service would use. Unlike retainer payments, for people who are self-directing services, the paid time off is not limited based on the state's nursing facility bed hold days, and therefore they can determine based on their authorized budget how many hours they choose to authorize paid time off. Next slide, please. Again, participants may designate funds from their current budget for paid time off using that budget modification process that Natoya shared with us earlier. Please note that participants may not use new COVID-19 related service authorization, such as those 360 COVID-19 respite service hours, or the additional $2,000 increase in their budget to pay or use for paid time off. Requests for new or additional service authorizations for support to supplement paid time off is also not allowable. Next slide, please.
What does retainer payments mean to participants, and what do they need to do? As a self-directing participant, you can move funds from services that are not being utilized due to COVID-19 pandemic to offer paid time off to staff.
Dr. Smalls, if you're talking, we can't hear you.
The CCS should discuss needs and services and the self-directed budget with a person to ensure that if they want to request PTO for their identified staff, they understand as employer of record, they may choose to do so. The discussion should be documented in the activity in progress notes. As in all these situations, the CCS is to assist the person in understanding the service options and provisions and how these services may address their immediate needs. The DDA has posted many tools that may be helpful in communicating the benefit of these provisions on the DDA website. Next slide, please.
So what does retainer payments and paid time off mean in terms of FMS? First, the FMS is to process budget modifications to move funds to cover PTO or paid time off as per DDA guidance. The FMS is to process authorized timesheets for PTO for staff, to track, report, and process claims. And lastly, the FMS is to follow up with DDA on process or person-specific questions. Next slide, please.
All right, so we're going to open up to some questions here on the box. If a person's family member has chosen to be staff during this time because they do not want staff in the home and have paid PTO and retainer fee to those staff, can the family member also be paid for providing these services?
That's a great question. And what you will need to identify is whether or not you have funding in your authorized budget to pay paid time off for one staff and also pay for another staff to provide services when that previous staff would have paid or would have provided your services. So it's really based on your authorized budget. The DDA would not be authorizing additional funds for that.
So what code would we use to indicate retainer payment in the additional 2,000 can that be used for retainer payments?
So as we've been sharing with these slides, for participant self-directing services, they will be utilizing paid time off as they historically have. So in this case, you would not need to indicate retainer payments. You would just need to determine, based on your authorized budget, funds that you would want to use for paid time off.
Okay, I'm going to continue on to our presentation, then I'll get back to some of these questions because there are lots of them.
So the next section talks about the different service exceptions that we have included into Appendix K to support more flexibility related to our service requirements and limits, and to issue this in a temporary basis. This includes exceptions to our employment discovery and customization in terms of the time frame that it must be modifications, where bids are not required, and you can utilize a family member to support you in the modification. And thirdly, to be able to request approval from DDA to exceed the limit. It includes being able to use family peer mentoring services more than the current limit of 8 hours a day, if that would meet your needs, and also provides the opportunity to access family caregiver training and empowerment services to increase beyond the current daily limit, and also to provide this option for new paid caregivers. For housing support services, it also provides the exceptions. Next slide. Under the individual and family directed goods and services, there are some additional exceptions there. We have included exceptions related to some of what we have currently as disallowable options, to include the ability to seek reimbursement for delivery of groceries and food, to be able to utilize it for internet access at this time, and also, again, to access that personal protective equipment and supplies. For meaningful day service exceptions, that includes the number of hours per day and per week and the days of the week. For remote support services, there's also exceptions related to requiring informed consent if it's a group setting. Under the self-directed service delivery model, we've talked about various exceptions today, to include the budget modification and accessing that additional $2,000. For the support broker, there's exceptions related per month. In addition, the ability for participants, if they so choose, can hire their support broker to provide services, other services such as personal support. In the event that that is a choice that you are opting, the support broker would need to be paid under that different service based on the reasonable and customary rate. And finally, the ability to vehicle modifications and not have to go through the prescription for the modification. Details related to these exceptions are noted in Appendix K number 4.
As mentioned by Rhonda, under the DDA Appendix K, we received approval to support the immediate need for services and supports and provide flexibility with service requirements and limits. A participant can exceed the unit frequency limit, such as hours per day or week, as noted in the guidance, based on the participant's current authorized funding. For a proposed environmental modification, costs over $2,000 will not require 3 bids in order to be authorized. Services can be provided by a family member or relative, and costs may exceed a total of $15,000 if approved by the DDA. The items mentioned are examples of some of the service exceptions. Unless specifically amended or addressed in Appendix K approved by CMS, all other existing services and requirements of the DDA waiver programs are still in place and must be followed. Individual and family directed goods and services exceptions under our self-directed service delivery model include staff recruitment and advertising, Dedicated funding may be increased to up to a total of $1,000 per person-centered plan year. COVID-19 related personal protective equipment and supplies can be purchased under individual family directed goods and services. Individual and family directed goods and services may fund goods and services during this crisis that provide or direct an exclusive benefit to the participant. This includes food delivery services, utility charges, fees associated with telecommunication and internet, and service animals and associated costs. As a reminder, in order to use funds, there must be a cost saving in the authorized budget. The requirement that a support broker is prohibited from providing any other waiver program services besides support broker services is temporarily waived. The support broker may be paid to provide other waiver program services to the participant at the rate applicable to that other waiver program service. Under Appendix K approval, support brokers may be provided up to a total of 20 hours per month. Participant can move funding from other services not being utilized during this state of emergency for an increase of support broker hours. The DDA will also consider requests for additional funding in the event funding is not available within the participant's currently authorized budget.
The CCS is responsible for discussing the needs, service, budget, and options during their wellness checks and monitoring and follow-up activities, and document such in the activity and progress notes. The CCS has an important responsibility to assist the person in understanding these service exceptions and how they may help to address their immediate needs due to COVID-19. Next slide, please.
In terms of service exceptions, the FMS will process participant authorized timesheets and invoices for staff authorized to on current budget and service items on the DDA COVID form number 5. The FMS will track, report, and process claims using the existing procedure code, and the FMS will follow up with the DDA on process or person-specific questions. Next slide, please.
Hi, I am going to move us through, and then I'm going to hold the question towards the end only because it's 3 o'clock and we're going to end at 3:30. So I want us to go through the presentation and then we'll open it up for questions. So Rhonda, go ahead.
Great. So the next section is about staff training and onboarding flexibilities, and recognizing the need to expand or maintain our current workforce. We made some modifications to these requirements. This includes the ability to hire relative or legally responsible individuals as staff, the ability to make an exception to age requirements and utilize someone that is at least 16 years of age or older, the ability to waive requirements for a high school diploma or GED requirement, the ability to utilize an abbreviated criminal background check so that you could start receiving services sooner and then follow up with the full background check, and also exceptions related to training requirements such as CPR and first aid, and the exceptions related to Maryland professional licenses to have current licenses. These are all noted within Appendix K, exception for pre-authorization. Next slide, please. In addition, the DDA, under the Secretary's order, has shared information related to the ability to receive remote services. So to support the health and safety of participants, families, and staff during this COVID-19 crisis and prevent transmission and spread of the disease, whenever possible, individuals are encouraged to deliver services by remotely or telephonic means. Under no circumstances should remote services be provided and used to assess a participant for a medical emergency. This information and guidance is noted in the Secretary order noted here on the screen and also posted on the DDA website. Next slide, please.
Staff flexibilities allow you to hire more relatives and legally responsible individuals as staff. Additionally, you can decide not to require specific staff to complete or renew all required trainings. These are just some examples. For more support services, exceptions include informed consent for all participants in the residence can be waived to address the limited staffing resources currently available. When consent is waived, all participants must still be informed that remote services are in use. You can choose different ways to receive services such as Skype, Zoom, FaceTime, telephonic, or direct care. You will need to inform your FMS of the staff flexibilities you choose to use. When this service is rendered by relatives or legally responsible individuals, participants are responsible for ensuring that services are provided as authorized in the PCP or person-centered plan, and that billing occurs in accordance with the DDA requirements. You should track staff that you made exceptions for, as they will need to meet the training requirements after the state of emergency.
During wellness checks and monitoring and follow-up, the CCS should assist the person by helping them understand the flexibilities that they have in hiring staff, as well as how services can be provided during the pandemic. This discussion should be documented in LTSS in the activity and progress notes. CCS continue to be approved to conduct monitoring and follow-up activity telephonically as well. Next slide.
In terms of staff flexibilities and remote services, the FMSs will acknowledge staff flexibilities the participant chooses to exercise for specific staff, facilitate new employee and vendor-related processes and paperwork, track staff that were granted training and onboarding flexibilities, track, report, and process claims, and follow up with the DDA on process or person-specific questions. Next slide, please.
Natoya, I'm going to move over to the form so that we can then leave some time at the end for our questions. So can you proceed, please?
Okay, we've created a fillable form to support the use. So with this form, you can request to move funds across existing budget service lines or add new service lines, request to increase budget up to $2,000, request to increase budget above $2,000, and request for retainer payments. Next slide, please. In section 1 shown here, the participant will be able to request to move funds across their existing approved budget service lines or request a new COVID-19 related service. It's important for the participant to make sure that the amount they choose to reduce for any service equals the amount applied to another service, either current approved or newly requested service. So for example, if a person's day program is closed and they now have increased need for personal supports, they should document in the service being reduced section how much they want to reduce day habilitation by. This specific amount must equal the amount that is chosen to be moved to another service line, which in this case will be personal supports. The person can also choose to request a service which is not currently authorized in their budget as long as it is COVID-19 related and would address an immediate health and safety need. The participant will submit this form directly to their FMS agency. If a new COVID-19 related services was requested in section 1, the revised cost detail sheet will also need to be completed and reviewed by the DDA. No revised PCP or modified service funding plan will be required if the services requested are COVID-19 related. Only non-COVID-19 requested services will need to go through the standard modified service funding plan and revised PCP process. In a moment, we'll talk about how that service can be approved. In section 2 shown here, the participant can request an increase in their approved budget amount up to an additional $2,000 in total cost for any of the following COVID-19 related services or items, or combination of these services or items. The DDA has authorized each participant to be able to exceed their budget by up to $2,000 for specific services that will support them during this COVID-19 pandemic. If needed, funds may be used for, again, any combination of the following services. It includes additional direct support service hours, for example, personal supports and community development service. It may use to increase support broker hours up to 20 hours per month. So in the event that new staff must be hired, an additional $500 may be used for staff recruitment for a total of $1,000. Funds may also be used to purchase personal protective equipment or supplies, not limited to gloves, masks, gowns, face shields, cleaning supplies. The 14% payroll tax must be applied to all direct support services, including the support broker, if applicable. Together with their team, the participant needs to document the number of service units requested and the overall cost. Again, the DDA has authorized up to an additional $2,000 for eligible service and items mentioned. If the participant service needs exceed this amount, again for $2,000, this form and documentation supporting the request should be completed and submitted to the DDA for review. The FMS may approve all requests as long as all of the criteria are met. The requested service is one or any of the combination of the services mentioned before. If the participant request exceeds $2,000, the participant must submit supporting justification along with the completed DDA COVID-19 form number 5 to the DDA for review. Next slide, please. The FMS may deny all requests to increase the participant's budget when the requested service or item is not one of those approved for the increase. The request is for payment of paid time off for direct support staff, or the total additional cost for services requested exceeds $2,000 and was not approved by the DDA. If the FMS denies the request for services up to $2,000, the participant and, if applicable, their legal guardian or designated person, their coordinator of community service, and their regional office will each be notified of the denial. Next slide, please. The form also indicates a signature section where the participant or legal guardian signs that the services in a request meet immediate health and safety needs due to the COVID-19 pandemic. After reviewing the form, the FMS will sign indicated approval or denial that requirements were met. The DDA regional office will review every case where the FMS denies the request, or if found proper, will issue notice of its decision noting legal and factual basis for the determination and applicable appeal rights. The DDA will also review and approve or deny all submitted requests which exceeds $2,000.
So Ron, let's go over the cost detail sheet.
Okay. So the revised cost detail sheet that has been referenced throughout the presentation, this is an illustration. We basically made two essential changes. This first tab here is the instruction tab, where we updated the instructions to support the service request as a result of COVID-19, COVID-19 state of emergency. Second, next tab, please, or next slide. The second tab is also what was added. It's called the justification tab. And yes, the justification tab was added to essentially answer 3 threshold questions that we've talked about before in terms of the request. What is the need? What is the risk that this need is, this request is addressing? And how is the request of this service mitigating the risk? Those are 3 questions you'll see listed here on the form. And then we ask that when the cost details being filled out, that the date of the agreement with the individual is also requested here, the name of the person filling out the form, as well as the signature and the date. Moving down to the bottom, you'll see something called RO review, meaning regional office review. There's a box there for a decision, for a sentence or 2 on notes, or what the decision is to describe it, and then notes where it says regional office notes. Scrolling further down, you see DDA office with regional office review. We ask that the regional office type either approved or denied in one of the boxes, and then the regional office director will sign and date the form. And the next slide, please. And then the next tab is something that we're all familiar with, which is the budget tab, is where all of the basic essential information gets filled in to help populate rates for the cost detail. This has not changed. Next slide, please. And this is the last tab called the Personal Supports and Add-on Tool, which has not changed as well. But basically, this is where we do we capture add-on services as well as the detail for personal supports in order to populate rates and costs in the cost detail. Next slide.
So this revised cost detail sheet may look new to some of you on the phone in the webinar. Please note that the CCS, your Coordinator of Community Services, is the one that would assist with completing this form, and are familiar with this form as it is used thoroughly with our traditional service delivery model. So they're familiar and can help you with that. Once the CCS submits that cost detail sheet to that dedicated secure email account for the regional office, the DDA will acknowledge receipt of that email. We are going to review that request and look at that justification and assess need. And then based on our determination for that assessed need, we can authorize the service on the form and as needed within TCIS2. We're going to upload that authorization into LTSS under client attachments. And then we would also be sending that form back to the requester with DDA's determination, and also to the FMS as an indicator of our authorization of that new or increase in services and funding. Next slide, please.
So Natoya, let's go ahead and move to what are the participants' requirements as the employer record.
Sure. So as the employer record is very significant for the participant to review new Appendix K provisions and flexibilities. It's also very important to make sure the participant knows what he or she would like to use. Request assistance from your CCS, so Pro Broker, FMS, or DDA regional office. And then also ensuring that you know that you can move funds to meet your immediate need, including from services you are not using to services you need to use today, to add or increase paid time off if you have exhausted previously allocated paid time off in the retainer payment, and to make sure you have and maintain a current authorized budget.
The CCS should attempt to conduct and document regular weekly participant wellness checks. They should continue to support their person in completing and submitting the following forms: the DDA COVID form number 5, the revised cost detail sheet for the participant to DDA for all new COVID-19 related service requests. The CCS will also submit assist in completing the modified service funding plan request form and submit to the DDA per the standing process for requesting any non-COVID-19 related services. They will continue to accept verbal and electronic signatures for service request and approval during this time. The CCS should follow up with the DDA for process guidance or for support in specific person-focused questions. And when service needs are evident, the CCS should support the participant in completing the DDA COVID form number 5, which the participant will then submit to the FMS. Next slide, please.
So the support broker will support the participant by sharing information related to new employee-related flexibilities that we talked about today, such as the staff training and onboarding. If requested by the participant, the support broker can be considered being hired to provide personal support. In addition, they can coordinate and communicate with the coordinator of community services and other team members related to those employer supports that they've been providing. Next slide, please. For the fiscal management services, the fiscal management services can support the participant by sharing information. They, as we've been talking about today, will process requests as per state and federal requirements, including the new PK provision and guidance. They can also accept the verbal and electronic signatures and follow up with the DDA on process or person-specific questions, including additional funding allocations. Next slide, please. So just a reminder that we have a variety of resources on the DDA website to include all the Appendix K guidances that we have referenced today and noted on the screen. Next slide, please. We also want to share and encourage you to carefully review that information on the dedicated Appendix K website, which includes our at-a-glance documents, those topic-specific guidance memos that we just showed, the frequently asked questions, and our webinar questions. Please note that the questions that you have submitted to our dedicated DDA Toolkit information account, we have reviewed and will be posting today answers to all those questions. So please review those, and after you review that information, if we have not addressed your question either in the guidance, the webinars, or that FAQ, then please send a new question to the DDA Toolkit info@maryland.gov. Next slide, please.
And what we're going to do with the questions from today, because we have lots of questions, and on hindsight, we should have done like a 2-hour webinar so we had more time to dialogue with you. I am going to spend the next 10 minutes really going through the questions that are on here to be able to answer and engage with you. Whatever we do not answer, we are going to roll it up and be able to then post it on our website from today. So I'm going to go back to where I last stopped reading questions, and then I'm going to see if I can just read as we go through until we get to the 3:30 time frame. So must the staff have an approval to return to work? If they are COVID positive and you've been informed of that, then yes, you need to have something that they says that they've gone through their I can't think of the words, the quarantine, their service, their medical procedures, everything, and then you should have something from the primary care doctor to say that they are no longer showing any symptoms of COVID. Let's see. When is there a positive diagnosis? Is the CCS responsible for reporting to the health department and DDA? No. As an employer of record, the person who is the employer of record is responsible to coordinate and work with the health department, and the health department will make sure to keep track of that. It is the person's responsibility as the employer of record to inform the DDA. So the employer record, which is the person who's self-directing, is responsible for contacting the health department and also DDA. Can individuals offer bonuses for staff during this time?
So that's a great question. Remember that you need to stay within your authorized budget, and benefits would be determined by the employer of record. So if you have the flexibility, that's an option to consider. But again, you should not be requesting additional funds from the DDA if you're exercising that option.
So I have multiple questions. They're all coming in a little different, but the goal is here, they're asking is, are the FMS agencies ready to accept Form 5 request? We expected everyone, when the minute that Appendix K was approved by CMS, that we would be including and implementing. In my last webinar, I share with you all that everybody has to have the housing order. Everybody has to have everything ready to go. And so we have been working and talking to the FMSs to set things up to how they're going to process what they're going to do. And we've been working and talking to the FMSs. So we ask that you also work with them. But as far as we are concerned, this is a go, this is the process, this is what you need to do to be able to do this request of the 2,000 or anything above the 2,000 or any new services. So we all in this together. So we have to work in this together. And if the FMSs are also working with us, getting guidance and support, but the question would be, the answer would be yes. And if they're not, we'll be working with them to make sure that they have the proper supports to do this. So what, sorry, this one I'm going through because I want to, there's lots of questions in the question box. We talked about where you can find the forms, but Rhonda, do you want to say again where they can find the forms? Because there's lots of questions after you said that have been asked.
Yes, the DDA dedicated Appendix K website, which we have shared in multiple correspondence, but it's on the DDA. If you go to the home page, you're going to be able to click on COVID-19. For DDA, it'll take you to a screen, then you can click Appendix K. When you get to the Appendix K screen, you go to the near the bottom, and there will be a title called Forms, and you will see the DDA COVID Form number 5 there.
So there's a specific question about iPads. Can iPads be purchased with the $2,000?
So iPads cannot be purchased with the $2,000. Participants can utilize their own funds to purchase iPads if they want. If they have an assessed need related to COVID-19, they can make a request for assistive technology.
Can you tell us how long the retainer payments can continue?
So that's a great question, and we're going to be sharing some additional information related to self-direction. So under self-direction, you do not need to request retainer payments. You do not need to code anything as retainer payments. What we want you to think about is if you, which in essence is the same thing as what we're using and terming as retainer payments under the traditional model. But we will not be using retainer payments for self-direction because as employer of record, you can determine within your authorized budget what you want to use for paid time off for your staff. So there is no limit except for what is absorbable within your own budget.
If the participant already has 500 of individual and family directed goods and services in their budget, do they get to request an additional 500 out of the 2,000?
That's a great question. So the DDA, per the Deputy Secretary, has allocated $500 for everybody who's self-directing services under individual and family directed goods and services for the sole purpose of staff recruitment. The additional $2,000 that we're talking about today that you could access if you need it, we're supporting to exceed that $500 limit for staff recruitment. And you could ask and use another $500 for that, a total of $1,000.
Can the 2,000 be used for hand sanitizer?
The $2,000 can be used for PPE and cleaning supplies, so that could be an option to be explored.
I guess I'm asking if the retainer payment is the same rate of pay the employees of record set in the budget. Rhonda, can I ask you to explain a little bit again about the retainer payment and how it does not apply for self-direction and why? Because there's lots of questions about that and you're going in and out. So I'll let you know if we don't hear you so you can repeat it again, okay?
Yes, and again, I apologize that the reception is just not good where I'm at right now for some reason.
Ryan, can I ask you a favor? Can you mute your line too? And anybody who's presenting, mute your line and see. I'm asking Ron and everybody who's presenting to mute, so it'll help you a little bit. So go.
Okay. So under the traditional service delivery model, we are implementing retainer payments as noted in Appendix K, which will have specific limits in terms of the number of days and hours, and also if it relates to meaningful day services, we are limiting the amount of reimbursement up to 80% of the rate. We are not applying retainer payments and those provisions or restrictions under the self-directed service delivery model because participants, as the employer of record, have the ability to identify and set aside funds for paid time off from their current authorized budget, and they will use that, which is like a retainer payment, if they so choose to pay their staff. They have the flexibility that we in the retainer payments for the traditional side. Whether it's traditional services and retainer payments or self-directed and paid time out, both of those two options, the authorized budget, the current authorized budget must be used. It is not adding additional money under traditional service model for retainer payments, and we are not adding additional funding under self-direction for paid time off.
So Rhonda, as a participant, do we need to submit the Form 5 to request PTO for employees' regular respite hours until we feel safe for them to come back to work? Do we need to transfer money, or may we use wage already set aside for the respite?
So what I would suggest is coordinating with your coordinator of community services and looking at your options and your immediate need. Today is a different day for all of us because of our stay-at-home orders, because of our state of emergency. So look at your immediate needs, look at your budget, look at your staffing, and based on that, you can make decisions. If you need to just move money in your budget to be able to increase your personal supports to meet your needs, that's something you should explore. If you need some additional funding, you could look at that $2,000 increase. If you would like to access those respite hours, you can do that. You do not have to submit any forms to us. You can contact your FMS, let them know who your respite provider is so they can help facilitate that paper, and then you can start to access that. But again, you need to assess where you are today, what your needs are today to meet those services and support.
Thank you. Everyone, is a little bit after 3:30. Want to be respectful of all your time. I do want to answer some questions quickly that were critical. Will the ARC center just remain as the FMS? As if we're aware, yes, they will remain as the FMS after June. And we'll be happy to coordinate. Please remember that you can meet with, if you're in self-direction and you're a participant, you are an FMS agency or CCS, to contact and discuss some of these concerns or questions or information that you need with the self-direction leads for each of the regional offices. We will definitely, I'm going to leave the line open in case you want to chat and put a new question in there, because we will be answering every question on here and then sending back the answers not only to the participants in this webinar, but also posted on the DDA website. So thank you so much and appreciate you participating and joining us today. Thank you.